Today we're attending a call of a 20-year-old male who's fallen out of a tree whilst cutting down branches. When we arrive at the scene, we'll assess for dangers, being particularly wary of the chainsaw and other possible falling branches. We'll also be wearing our PPE heading into it. When we arrive, we will assess for safe exit routes, and we also want to recognise the mechanism of injury. The patient could have a range of injuries ranging in severity. Hello, I'm Megan, this is Tash. We're with St. John's, we're with the ambulance, here to help. What's your name?
Amelia.
Amelia, and can you tell me what's happened today?
I was cutting some branches and I fell on a tree.
And you fell out? I can tell because Amelia is able to respond to me that her airway is clear. Are you having any trouble with your breathing?
No.
No, and no trouble breathing. She also appears to have a GCS of 15. I can see, Amelia, that you've got quite a large laceration on your arm. Are you happy for me to bandage this up?
Yeah.
Ooh, I'm going to clean the wound with saline to begin with. Also wet a bandage to prevent it from sticking. And then I will apply this to the wound with direct pressure and minimal surface area. Yep. I'll also take a pulse just to make sure that the hand is still perfused, which it is. Tash, while I'm bandaging the arm, could you please take some vital signs? Could you take blood pressure and also take the chest for me?
Yeah.
When bandaging the arm, it is good to rotate the bandage and then apply tightly. This enables me to apply a more localized pressure to the wound.
And then if I just take your blood pressure, it's okay. Maybe a little bit tight.
After applying the bandage, I will check capillary refill to make sure the hand is still being perfused. And that is 4 seconds, which is slightly slower than normal, but considering she has a wound, nothing to be too concerned about. Now, do you mind if I take your heart rate?
No, okay.
So I'm going to measure the heart rate using the distal pulse. And I will count this for 15 seconds and then times by 4 to get a heart rate over 1 minute. Once I've done this, I will also watch the chest rise and fall so I can gain a rest rate. I will count this again over a time of 15 seconds and times by 4 to get a rest rate over 1 minute. So her heart rate is 80, which is slightly higher than normal, but still within a normal range of between 60 and 100. And her rest rate is 20, which is again slightly higher than normal, but within the range of 12 to 20. I'll also just elevate the arm over her chest there. And what do you get?
So she had a blood pressure of 100 over 60 and her lungs sounded clear and equal.
So lungs sounding clear and equal, so nothing to be concerned about. Blood pressure is 100 over 60, so slightly lower than normal, but again, considering she has a wound, not to be too concerned about. Now, Amelia, I want to do a rapid trauma sweep, which just involves feeling your body for other injuries. Are you happy for me to do this?
Yes.
Perfect. So I'm just going to start at the head. Can you tell me if you have any injuries? From here, in the back of your neck there.
Yeah.
Cool. Anything up the side?
No.
All right, Tash, I'm concerned she has a midline C-spine pain around the back of her neck. Could you just stabilise that for me, please?
Yeah.
Cool. Tash is just going to hold your head. Any pain down here?
No.
Cool. I'm just going to feel the sternum. Any pain down there?
No.
Perfect. And any pain in your hips?
No.
Any pain down your leg?
No.
Perfect. Up here?
No.
Down here?
Yeah.
Bit of pain? Alright, we'll just look at this. I just want to expose the legs so I can compare and contrast them. Are you happy for me to pull your pants up?
Yes.
Alright. Just do that. I can see now that she has a angulated right leg. I just want to check for perfusion of the feet. The feet feel warm to touch. I'll just check the distal pulses. They both have pedal pulses as well. Are you able to feel me rubbing the bottom of your feet?
Yeah.
And they both feel the same?
Yep.
And can you bring your toes for me, please? Perfect. That's good. Because she is able to move her feet and as well as his pulses, I can tell she has good neurological and cardiovascular function in her feet, so I'm going to turn my priority to her midline C-spine pain. So what I want to do with Amelia is place a collar on you, which is going to help mobilise her neck. Due to the mechanism of injury, the distracting injuries and her midline C-spine pain, it gives me good reason to want to place a collar on her neck. Are you happy for me to do this? It's going to make your neck a bit stiff, but it's going to keep your head nice and still and help to prevent any other further injury.
Yes.
Cool.
To place the collar on the patient, you want to measure from the top of the clavicle to the bottom of the jaw, which is sort of 4 fingers. Then you just want to measure on the collar to make sure it's going to be a good fit, which it is. Tash, I'm going to ask you to stabilise the head for me while I just slide this underneath, please. Alright, now I'll go. I want to slide the under and just wrap that around. Perfect. In an ideal scenario, I would ask Tash to continue to stabilise the head or a bystander, but because I need Tash to help me with stabilising the leg, I will place towels beside the head to provide a manual support, just to help further mobilise the head. Tash, I've noticed her wound has started to bleed again. Would you mind just applying another bandage to that for me?
Sure.
And what's your pain like at the moment, Amelia?
About 8.
About an 8. So because her pain is moderate to severe, this gives good indication to be able to administer methoxyfluorine.
Do you mind if I just apply another bandage?
So do you have a history of malignant hypothermia?
No.
And do you have any renal or kidney problems?
No.
Have you ever seen this drug before?
No.
And do you have any allergies I should be aware of?
No.
Have you had methoxyfluorine in the last week?
No.
Perfect. So the drug I want to give you, Amelia, will make you quite lightheaded, possibly drowsy, and possibly nauseous, but it's going to really help with your pain. Are you happy to take this?
Yep.
Perfect. So before giving patients drugs, you need to make sure that you perform appropriate drug checks. These include the 5 R's and the 4 C's. So the 5 R's, I want to be able to check that I have the right patient, which is Amelia, the right drug, which is methoxyfluorine, make sure that I am checking the right dose, which is 3 mils. She's allowed 6 mils for this week, so I'm allowed to give her 2 doses of this. Route will be self-administered orally, and I need to make sure that I take a note of the time. In terms of the 4 C's, I need to be checking that I've got the right concentration, that the clarity of the drug is okay and there's nothing in there, that the integrity of the packaging is okay and not broken. As well, I need to make sure that the drug is not expired. Also, when administering drugs, you want to get a second opinion. So, Tash is my offsider. Can you please also just double check that this is the right drug?
Yep, so this is methoxyfluorine. It expires in 2019. 3 milliliters, and the clarity and integrity of the packaging looks okay.
Perfect. So Amelia, this is a self-administered drug and you take it just by sucking on the whistle here. I'm just going to put it on your hand for you. There we go. And whenever you want, just take a puff of that and that's going to really help with your pain. So methoxyfluorine will manage her short-term pain, but I also want to be aware of managing her long-term pain, in which case I'd like to give paracetamol. So Amelia, do you have current paracetamol poisoning?
No.
And I'm aware that she has no allergies. Because she's in a C collar, ordinarily we would give tablets, but because she's in a C collar, it'd be more appropriate to give her in a liquid form so she can swallow it. What's your weight?
60.
And because she's 60 kilos, she's within the range of 50 to 70, so it would be appropriate to give her 20 mils of paracetamol orally. When giving her paracetamol, you would also want to perform the same drug checks you did with methoxyfluorine, so go through the 5 R's and the 4 C's, as well as getting your offsider to do the drug checks as well. Now that her pain's managed, I'm going to do something about your leg, Amelia. So I'm going to put it in a splint. This is going to help stabilise it and also help with the pain. So when putting on a splint, you want to make sure you measure it from the ankle, in this case from the ankle to just above the knee to provide a good support. That's good, so I want to take that up. Tash, okay, that's all good. I'll also put a towel in the splint just to make sure that the leg is comfortable and provide a bit more support. And I'll also just put bandages underneath, ready to go to minimize the movement we're going to put this leg through. So we're about to splint the leg, Amelia. So it's going to hurt quite a lot. So I want you to take some deep breaths in and out of your methoxyflurane whistle for me. Before splinting the leg, I want to just quickly reassess that she still has a pulse, which she does. And can you still wriggle your toes for me? Perfect. And her feet are still warm to the touch and perfused, so that just gives me a good baseline. Tash, if you can, I'd like you to hold the leg and keep it steady while I slide the split under for me. On 3, 2, 1, lift, and back down now. That is perfect, and if you just want to hold that up while I tie these on. Thank you very much. When tying the ties, you want to make sure that you're not tying directly over the site of injury, and you want to make them nice and stable on the leg. I'll just tie this one over here. Perfect. After splinting, I also just want to check again for distal pulses, which there are. And can you still wriggle your toes for me? Perfect. And can you feel this?
Yeah.
Lovely. So that all hasn't changed. I can see now that your arm is still continuing to bleed. I will now apply a tourniquet. As the arm is continuing to bleed, I wouldn't want to enter a state of hypovolemic shock. So Amelia, I want to put a tourniquet on your arm. It's going to be really tight and it's going to cut off the blood to the rest of your arm. Once we put it on, we can't take it off, but it's really going to help with your wound. Are you okay for me to do this?
Yes.
Perfect. When putting on a tourniquet, you want to make sure that you apply it 10 centimetres proximal to the wound. You want to do it nice and tight, twist the bar, and also take note of the time that you apply it. After applying, you want to check for pulse, which there is none. That means it is hopefully working. If the wound is continuing to bleed or the pulse is still there, you can apply another tourniquet directly distal to the original one, being careful not to take the first one off. Tash, would you just mind removing that bandage so we can just double check that the wound has stopped bleeding for me?
Yep.
Amelia, I just want to take your blood pressure again to start reassessing your baseline vitals. Are you okay with this?
Yes.
Perfect.
Still doesn't appear to be bleeding.
Perfect. Perfect. Blood pressure remains to be 100/60, which again is still a bit low, but it does not seem to be decreasing. I'll now just have a listen to your chest to just make sure it is still clear and equal. Are you okay for this?
Yes.
If you just want to take a deep breath in, please. And out. And one more. And out. And one more. And one more. And one more time. That's perfect. Your lungs remain clear and equal.